Thank you for inviting me to speak on World AIDS Day. It's a lovely honour and it marks my recent retirement from the Burnet Institute and the Alfred Hospital later this month, after 30 years of HIV research and looking after patients. The theme for World AIDS Day 2018 is Everybody Counts, building a united response to HIV infection globally. As the director of the Healthy Ageing program at Burnet until recently, under that banner of Everybody Counts are all those people living with HIV who are getting older. We must ensure that older people living with HIV are not forgotten, and we must make sure through our research that we understand how HIV impacts the ageing process, causing inflammation that is the evil root of diseases associated with ageing, such as heart attacks and strokes. And we must also try through our research to halt these accelerated age-related changes that occur in the immune system of people living with HIV. With our colleagues at Living Positive Victoria and Thorn Harbour Health, we're also working to understand the specific needs of people living with HIV in Victoria as they get older, particularly those who are geographically or socially isolated. We know their needs will be very different to younger people living with HIV and also to uninfected older members of the community. These areas of research are so different to my early research and early patient care. When I first started looking after patients with HIV at Fairfield Hospital back in the 1980s, we never dreamt that we would get treatment that would allow our patients to live into old age. Many of our patients died even before the age of 30 years. Imagine a time when we had to look after patients without access to a reliable CD4 test, or before we knew how to measure viral load. When I arrived back from 2 years working in San Francisco in 1988, I set up CD4 testing for our patients, and a bit later my research team developed viral load testing in Australia, then genotype testing, so we would know what drugs remained active against HIV after years of sequential monotherapy. In the clinic, we tried one drug after another as each became available, and with the early combinations, sometimes our patients were taking 20 pills a day and even more. But during my career, this has all changed. Now, when I see my patients in the clinic, I'm most worried about preventing their heart attacks and strokes or the onset of diabetes. Now, most of my patients are well, most have an undetectable viral load, and for many, this is managed by just one pill a day. This is not just in Australia. As part of Everybody Counts, access to safe and effective treatment and healthcare is happening globally, and we must ensure this is true for every person living with HIV in every country. How fortunate I am to have been part of this global effort and to be seeing the changes that have occurred, and how lucky I am to have patients who've trusted me with their care, many for 20 or 30 years, that I am now seeing them grow old with HIV.